Well, let's speak to the Conservative health spokesman, Sandesh Gulhane, who's also a GP. Good afternoon to you. And what do you make of these figures then?
Andrew, good afternoon. It's heartbreaking. It's awful. 1,330 people died that didn't need to die. 9 less than last year. It's the same numbers. Absolutely heartbreaking. And it's not just the person that's dying here. There's a family, there's a community. People are hugely affected. And you've just heard from Katrina, 15 times more likely to die if you're from a deprived area. How awful is that? And I see this in my surgery. I see people coming in crying because people have died from a drugs overdose. I've seen people struggling. People aren't getting the help they need. And the Scottish Conservatives have a solution, and we're putting forward the solution. And we've put a bill forward, right to recovery, backed by charities. And the idea is to get people the help that they need when they want it, because you only have a small window when people ask for help. And we're just not doing enough. This is our national shame, and this is an emergency that we need to deal with. And the SNP simply haven't been doing that.
The Scottish Government says it's putting £250 million more into dealing with drug deaths, and it's expanded residential rehabilitation, among other things. Are those policies you think can make a difference?
Well, you saw the report that came out not long ago, which said this is not nearly enough money. Not nearly enough money to make any difference to the emergency. But let's be clear, the SNP has been in government for the entire time that we're seeing these horrible, horrible figures coming out. And we talk numbers, but we have to remember each figure is a person. And we also had a report that came out in Parliament that showed us that the medical assisted treatment standards, only 17% of them were met. This is awful. This is absolutely abysmal. And this is a government who is, you've heard from the drugs minister, Angela herself said this is unacceptable. But what you don't hear is her going on to say that it's unacceptable and the SNP are responsible for it. And this is what we need to do. We need to take the responsibility and we need to make changes. And the Scottish Conservatives have a solution that will help people, and that's the Right to Recovery Bill, and we need it to be backed.
Yeah, so your Right to Recovery Bill you've introduced to Parliament, and the Scottish Government has previously said that it would consider backing the bill. How does giving a right to recovery for someone who's struggling with drug problems work? Because you still have to have all the infrastructure in place to provide the treatment.
Yeah, so what I see, and let me tell you about patients that I see. When something normally happens, so there's normally an event that occurs. Maybe they've seen somebody overdose, maybe they've had an overdose themselves, but normally a big event has happened. And that then drives the patient to come in to see me and say, I've got a problem with drugs, alcohol, I want help. And you have a very small window when they've asked you for help to be able to deliver that help, to be able to get them into a program. Now, what's happening at the moment is patients are being denied entry to programs because of other medications, other drugs they're taking, because of alcohol problems. They have to wait a long time. So what happens is patients who have drug addictions have chaotic lifestyles. And if you get them to wait a week, 2 weeks, 3 weeks, a month, and get them to then need to call in, they simply won't be doing that because of the way they live their life. And it's all very well for all of us who don't have a drug addiction to say, well, of course, it's easy to call in, but you don't realize how difficult it is for patients with drug addictions to do things like plan a month down the road to make a phone call to try to get help. We need to get them the help when they ask for it, because that's the window, and that's what the Right to Recovery Bill gives them, which is a right to go in to get treated and stop all this external noise that comes in to prevent them from getting the help that they need.
Do you think it's also now time for safe drug consumption rooms? I mean, health officials in Glasgow who are right at the front line and know their stuff tried to set one up, but they were blocked by the UK government because the Scottish Parliament doesn't have the powers to make it happen at the moment.
So one thing that we need to be clear about, and this is something that you're hearing more and more from the SNP. Now, we have the same laws in England as we do here.
I'm talking about frontline health experts in Glasgow that want this to happen.
So we have the same laws here as we do in England. and we have 5 times the drug deaths that we have in England. But I want to be clear: anything that could help patients is what I would be happy to back. And if the Scottish Government, and I said this on BBC Radio in November, I think it was, but if the Scottish Government come out with a plan, with a pilot scheme for where they would want to put drug consumption, if they come out with a plan of where, how, logistics, then the Scottish Conservatives would have a look at that plan, and potentially, yes, we would back a pilot to see if it would make any difference. And we would then go ahead and speak to our colleagues in the UK government and say that we would be backing the idea of having that here in Scotland. But we're not having that from the SNP. There's no plans that have come into place that would allow us to talk about a drug consumption room. But don't think this is the magic bullet, because the fact is, we don't have any consumption rooms down in England, and yet we have 5 times the level of deaths that they do down there.
Sure, but I mean, it's the idea of a drug consumption room was blocked by the then Prime Minister Boris Johnson, a London-based politician who probably doesn't know that much about Glasgow's drug problems. And then here you have a devolved government and health officials in Glasgow saying, this can work. I mean, perhaps the reason why the Scottish Government haven't spent time on a drug consumption room plan is because they always knew it was going to get biffed in the past.
So I think that's a little bit insulting to the Prime Minister, because
he's not the Prime Minister anymore. Well, not for much longer.
But he is, and he was, and what you get is when you get ideas coming through, it's not just one person that makes the decision. There's a team around there. There are people within government who are specialising in Scotland. We have the Scottish Secretary of State, Alistair Jack, with a big team who are just a few hundred yards from Holyrood. So to say that somebody sitting in Westminster is saying no is absolutely not the case. What we need to see is a pilot, and we need the SNP government to come up with the things that I've already said they need to do. And then we would happily take up petitioning to say, well, could we have the pilot? Could we try it, see how it goes? But we need to see evidence. We need to see the Scottish Government coming up with plans of where they're going to put it, plans of how they're going to do it, what are the logistics. How would we police areas that have safe consumption rooms? What would happen if you have a consumption room? Would you get a ring of drug dealers going around there? What happens to those drug dealers? These are all things that need to be figured out before you could go just crack on with a pilot. Do that, and then the Scottish Conservatives, I would support it as a pilot, absolutely, because anything we can do to save lives, we need to do.
Okay, many thanks, Sandesh Gulhane there, the Scottish Scottish Conservative health spokesman. I should say that actually Paul Sweeney, the Labour MSP, has brought forward proposals for safe drug consumption rooms to the Scottish Parliament.